Hello, everyone, and welcome to this audio podcast. This audio podcast series, this audio as part of this audio podcast series, and this introduction and aims as part of this audio podcast series. This audio podcast series as part of a Speckle report. This audio podcast as part of the Heighe Bedlam. This audio podcast as part of a Bedlam Plexar, and this audio podcast is part of a Storm Robotics production. So, around the introduction and aims to this in this audio podcast, the introduction and aims to as part of peer review and published works from 2021, looking at education empowerment and practice excellence, and looking at a practice review from 2021. So online portals and spaces have allowed healthcare service users to access supplementary information relating or regarding to health and disease through a broad range of modalities. The wealth of information available online for healthcare service users is vast, but much of it can be daunting and also can lead to misinformation. Can lead to misinformation. So healthcare service users with condition with varying sort of illnesses, illnesses can be sort of signposted or directed to resources that are appropriate for requirements or needs, and support for healthcare service users from healthcare professionals at the same time can be multifaceted, and so healthcare service users sort of can find sort of advantage from scheduling time with allied healthcare professionals whom for example whom are sort of trained to provide remote services. So, for example, in the times of the pandemic, for example, we saw there was a sort of an increase, if you like, an increase in the use of online modalities to access healthcare service provision in around sort of a variety of aspects across varying specialties of clinical and medical practices, for example. And so initiative would be initiatives can be sort of supplementary to aspects around healthcare as part of electronic patient records, and as part of electronic patient records. And so since around 2009, the RPSG, or the Renal Patient Support Group, has had a standing history of offering evidence-based sort of educational efforts to support healthcare service users and also healthcare service providers across sort of social media, but also as part of where the RPSG has a main sort of website. So online portals can improve healthcare service sort of documentation by facilitating more complete sort of records to be kept with fewer errors alongside improving the ease and efficiency on behalf of healthcare professionals, at the same time maintaining service use and patient sort of healthcare in context of documenting, providing documenting educational material would also reduce the sort of unnecessary sort of complexity and reduce a duplication and improve collaboration between multidisciplinary teams, MDTs. And again, during the time of the pandemic, or in around the pandemic, where healthcare sort of service provision from and between healthcare sectors would have had, for example, varying healthcare professionals been involved in line to aspects of healthcare service user care. So, for example, those with, for example, basic for example, physiotherapy, as where many patients or service users in sort of in sort of the in sort of wait for sort of face-to-face appointments. For example, there were, in the times of the pandemic, there were appointments in around healthcare, where healthcare around healthcare service provision, where appointments were carried out through the sort of social media platforms, or through platforms that interlink between healthcare sectors, but also between allowing sort of healthcare service providers to document aspects into electronic patient records. And so excuse me. So, for example, with physiotherapy appointments, there were those who during the times of the pandemic would have had issues in around sort of in around functionality in regards to, for example, in regards to where, for example, if there's sort of healthcare service users who for example, may be restricted, or may have constraints, may be restricted, or may be restricted, or have constraints. And so online there was opportunities for healthcare service users, where healthcare service users could access healthcare providers through tech, for example, so that healthcare generally between healthcare sectors will still have a sense of continuity, or a sense of continuum. And in line with this, if it wasn't for example, just around as physiotherapy, as an example, there would have been examples through varying multidisciplinary teams as part of the issues in around healthcare provision during that particular time. At the same time, telemedicine links for video consultations, imaging, and laboratory data could also enable laboratory teams to be involved in discussions with healthcare service users through, for example, group consultations. However, of course, any sort of education provided would require documenting and transfer of information, connectivity of any future technologies or links between electronic patient records would need to be, for example, would need to be sort of general data protection record, or GDPR compliant, according to the GDPR 2000 and GDPR, according to GDPR, the 2018. So in and around the aims and objectives of this, or the peer-reviewed and published works from 2021, the review sought to highlight whether it would be advantageous to involve MDTs in online consultations and or sort of educational sessions through the RPSG, through the Renal Patient Support Group, to improve educational practices, and also to increase sort of the sense around health literacy, for healthcare service users. And it sought to the peer review published works here from 2021 also sought to understand if it would be helpful to have follow-up online consultations with MDTs for healthcare, following routine appointments. So in regard to the remit of this peer review published works, it was in around looking at chronic kidney disease, or CKD, as an example, and where CKD primarily is a laboratory is primarily a pathology and laboratory based sort of health primarily a laboratory medicine and pathology based sort of disease or condition, let's say, and so the basis of having MDTs or multidisciplinary team meetings, depending on the scenario of where those suffering with CKD or chronic kidney disease, for example, would have access would allow access to depending on the scenario around a healthcare service user, would have access to a healthcare service provider based on that scenario. So, for example, if it was if it was around a laboratory test or investigation, then access online, or even through, for example, the RPSG, would allow healthcare service users to access a sort of a specialist in laboratory medicine. If it was to do with if a healthcare service user needed to speak to someone from a clinical point of view, clinical practice point of view, then access to a nephrologist would be amicable. If it was to do with if a healthcare service user had issues or had issues in regards to for example, where they may have had some radiological investigation, a radiological investigation. They could access someone who would and could sort of help with in regards to radiology, and from a radiological point of view. If there was someone, if a healthcare service user had issues, had a sort of a query or a point to sort of to ask in around sort of for example, around a sort of a nursing perspective, then access to access from an MDT point of view, multidisciplinary team point of view, would be where healthcare service user could access a healthcare professional from a nursing perspective. And so the aims and objectives of this were again to highlight whether it would be advantageous to involve MDTs in online consultations and or educational sessions through the RPSG. So that draws this initial audio podcast as part of this series This audio podcast is part of the Speckle report. This audio podcast is part of the Heighe Bedlam. This audio podcast is part of a Bedlam Plexar, and this audio podcast is part of a Storm Logistics production.